Okay, and now we have a question by Emrit Paul. I hope I'm pronouncing that correctly. What are the differences in musculoskeletal maneuvers learned by a chiropractor in comparison to an osteopathic physician? Are there any similarities? As I said before, the basic theory behind it is a little different. We're talking about circulation versus nerve function. But there are chiropractors who use some osteopathic moves. I'm not sure. I'm not familiar with too many osteopaths. So although my doctor was an osteopath who retired recently, in fact, he bought his practice back in the 1970s from the wife of an osteopath who had recently died. And that osteopath, he was a real old-time osteopath. He did a lot of manipulation. Most osteopaths these days do general medicine or specialties or surgery. So they're pretty much, they practice allopathic medicine just like medical doctors do. But my friend, who's my best friend, who's also my doctor, he did a lot of manipulation. What I find was that it's a long lever as opposed to chiropractic adjustments. Seems, at least the adjustments that I use, are very specific. We're trying to find that area where those red beads are and just get that to move and not do general manipulation that will also cause the compensation area to move, because that's already moving too much. So that can become an irritant. So basically, I'll try to demonstrate a little bit what an osteopathic move is, where the osteopath will get behind you and turn your head this way and turn it that way. They're quick, general, global kind of movements. Whereas when I adjust somebody, if I'm behind them, I have a special chair that does that I sit the patient in usually, and I'll sit behind them and get just that one little area. You want to stabilize everything else so it doesn't move, and just get that one area to move. And that seems to be the difference. When you do, for instance, a low back adjustment, generally speaking, with chiropractors, we'll have the patient have their front leg hooked, the foot hooked in the other leg. So one leg will be straight, the other leg will be bent. And so we'll lean against that leg that's bent and do the adjustment. Whereas osteopaths will get that top leg and stretch it back as far as it will go and get in between the patient's legs and do manipulation there. So it's a more general kind of movement. But a skilled osteopath can manipulate very well, and it has more to do with the actual skill of the practitioner, the experience of the practitioner, than whether it's osteopathic or chiropractic. But again, with chiropractors, this is primarily what we do. Sometimes you can go to an osteopath if your back's hurt and they'll do a manipulation. With chiropractors, this is all we do. So we're focused. We have a lot of different techniques and a lot of ways to get those joints to move.